students, welcome back. So in this video we are going to discuss some important management, which I said we will be discussing later, and another important brief question answers. So let's begin with first diarrhea. Plan C. What is the plan C management of diarrhea? Means minor dehydration. So definition will be some dehydration. The features will be the child will be restless, irritable, thirsty, drinks eagerly. Okay. Treatment. Home-based treatment is you have to give ORS, oral rehydration solution, 75 ml per kg body weight over 4 hours. Okay. Then after each loose stool, you have to give some amount of ORS. Now this depends on age. If the child is less than 2 years, you give 50 to 100 ml ORS. 2 to 10 years, you give 100 to 200 ml ORS. If more than 10 years, you give as much as desired. Okay. Continue usual diet. Now coming to zinc supplementation. If the child is less than 6 months old, give 10 mg OD for 14 days. And if the child is more than 6 months, give 20 mg OD for 14 days. Advise when to return immediately. If the child is not able to drink, if becomes more thirsty, if develops blood and stool, high fever, repeated vomiting, convulsions, then you have to call the child again. So this is the management, plan C management of diarrhea. Coming to next, that is snake bite management. So snake bite, we know there are two groups of snake, neuroparalytic and hemotoxic. Neuroparalytic consists of cobra and crate. Hemotoxic contains of viper, Russell viper. So first talking about the neuroparalytic snake bite. So first ABC, you have to maintain that injection atropine 0.6 mg IV stat, repeat 6 hourly. Injection neostigmine 2.5 mg IV plus atropine 1.2 mg IV, repeats 6 hourly. Okay. Then ASV, anti-snake venom, 10 vials IV in 200 ml NS over 1 hour. Repeat if required. Supportive care, ventilation if needed. Okay, this was all about neuroparalytic. You need to give ASV, atropine, neostigmine. Now coming to hemotoxic, you give ASV, 10 vials IV in 200 ml NS over 1 hour, same as we were giving in neuroparalytic. Repeat if required. Injection tetanus toxoid, analgesics, fluids, blood transfusion is required, and you monitor 20-minute whole blood clotting time, BT, CT, urine output, all that. Okay, so in hemotoxic we are not giving atropine and neostigmine. We are giving that in neuroparalytic snake bite. Now ASV dosage. Initial doses 10 vials IV in 200 ml NS over 1 hour, as we discussed earlier. Maintenance is 10 vials IV over 1 hour after 6 hours. Okay, and repeat 20 whole blood clotting time if not improved or neurosigns persist. Okay, so this was briefly about the snake bite management. Now coming to dog bite management by WHO. So we were learning there are 3 categories, 1, 2, 3 categories of exposure. So what is this? First category is touching or feeding animals, licks on intact skin. The skin is still intact. Okay, touching, feeding, licking, all this. Second is there is nibbling of uncovered skin, minor scratch or abrasion without bleeding. There is still no bleeding. Okay, there is just scratch, abrasion. Third is single or multiple transdermal bites or scratches, licks on broken skin, contamination of mucous membrane with saliva. There is broken skin, there is contamination, there is multiple transdermal bites. Okay, that is category 3. Now post-exposure prophylaxis, like how we manage a dog bite. So we learned the categories. Now accordingly, category 1, wound management will be wash with soap and water. Rabies vaccine on day 0, 3, 7, 14. Rabies immunoglobulin is not required. Category 2, wash plus apply povidone iodine. Rabies vaccine on day 0, 3, 7, 14. Rabies immunoglobulin is not required. Category 3, wash plus apply povidone iodine. Rabies vaccine on day 0, 3, 7, 14, 28. Usually we give day 0, 3, 7, 14, 28 in all categories. And rabies immunoglobulin is required if we use equine, 20 international unit per kg. If we use human, that is 40 international unit per kg. Rabies immunoglobulin infiltrate as much as possible around the wound. Rest intramuscular at some distant site. Injection tetanus toxoid. Do not give antibiotics routinely. Okay. Next question is, what are the ill effects of air pollution? So it is very common. It will, from above we see, then there is irritation of eyes, nose, throat, cough, bronchitis, asthma, COPD, reduced lung function, increased respiratory infection, headache, dizziness, cardiovascular diseases. Carbon monoxide will cause headache, nausea. Lead will cause anemia, nerve damage. Carcinogenic effect of benzopyrene. Adverse effect on plants, animals and materials. Coming to noise pollution, what are the ill effects? It can cause temporary or permanent hearing loss, tinnitus, sleep disturbances, irritability, stress, fatigue, hypertension, ischemic heart disease, reduced work efficiency, interference with speech communication. Right. Coming to water pollution, what can be the ill effects of water pollution? Waterborne diseases like diarrhea, cholera, typhoid, hepatitis A, dysentery. Water related diseases like schistosomiasis. Water related waterborne diseases and toxic effects like heavy metals, lead, mercury, fluorosis. Blue baby syndrome due to nitrate contamination. Bioaccumulation of chemicals. Bad odor, taste and color. Affects aquatic life and ecosystem. Okay, these are the ill effects of water pollution. Now coming to copper T. We have learned this earlier also. Copper T, DMPA, barrier methods and terminal contraceptive methods. So I am not repeating it. Again, there are ill effects of environmental pollution summarized: air pollution, water pollution, noise pollution. And there is a quick reference of the vaccine schedule. You can go through this. JE vaccine, diphtheria vaccine, OPV, vitamin E. Okay, so this was an overall most important topics touched: management and ill effects of various environmental pollution and all that. So thank you.